It's often said the knees are the first thing to go. Well, if that's the case for you or someone you know, partial knee replacement might be a good solution. Dr. Jeff Hodrick is an orthopedic surgeon with Southern Joint Replacement Institute. We appreciate you being with us today.
Good to be here, Mel. Thank you.
So tell me what causes problems with the knee that a partial knee replacement might be a good solution for.
Yeah, mostly what we're talking about is arthritis, and it's the osteoarthritis, or the gradual wearing down of cartilage inside the knee. And this can happen for a variety of reasons, and certainly can affect the entire knee, or occasionally can only affect just part of the knee. And I think what we're going to talk about today is partial knee replacement. I think it's a great solution that's a little bit less invasive and allows for a little quicker recovery as opposed to a total knee replacement.
All right, so you have a healthy knee here.
Sure.
What's breaking down? What's the problem?
Well, the way we like to think of the knee is in three different parts. There's the inside part of the knee, and then the outside part of the knee, and then the part that's underneath the kneecap. So three different parts or three different compartments. Now, someone can be bow-legged, and that causes stress just on one part of the knee, and then that part of the knee will wear down. And that's what we talk about, having just arthritis in one compartment of the knee. And those folks that have that then are good candidates for a partial knee replacement.
All right, we've got the model of that right here.
Sure,
let's talk about, yeah, who is a good candidate? Who's your typical patient?
Yeah, there's kind of two different ones, really. The young patient that really wants to be active and are really young, and we want to be as the least invasive and don't want to take away as much bone. And then also, some of our older patients actually recover a lot quicker from a partial knee replacement. And occasionally, if they just have arthritis in that part, they'll bounce back a lot quicker from a knee replacement, at least a partial, than a complete knee replacement.
So there's no need then to replace things that don't need replacing.
That's right. I think what I like to tell my patients is their parts are better than our parts.
Yeah,
and I think that's true. And there's some other advantages, I think, that go along with the partial knee replacement, as far as your knee feeling more natural after the procedure, because you're keeping some of the ligaments in the middle of the knee. So
what's the surgery like? What are you doing there?
Well, this is a model kind of demonstrating what we're talking about. So the surgery itself, we replace the damaged cartilage on both the end of the femur bone or the thigh bone, and then the top of the shin bone or the tibia bone, and then those are replaced with metal, and then in between is this plastic bearing that slides back and forth. And the whole idea, again, the remainder of the knee is normal, so we don't replace that part, and that way we can obtain the same natural feeling knee that they had before the arthritis.
Is it possible then that in later years the other part of the knee could break down? You might be looking at a total knee replacement? That
is a possibility, and certainly that's one of the reasons why someone would have to have additional surgery. Now, that's one of the things we try to be careful of, because certainly we wouldn't want to change the alignment of the knee that would put pressure on other parts of the knee. So you have to be very careful, and it's actually a little bit I think occasionally more difficult to do a partial than to do a complete for that reason. You certainly don't want to overcorrect someone to put pressure on that other side.
Sure, which is why you need a real expert to do it.
Well,
obviously.
That's what I think so.
Yeah. Tell me about the seminar that you have coming up.
We do. On Tuesday, the 25th of this month, we're going to talk about mostly knee replacement, new and emerging technology. Basically what it is, and what's really good for the patients, what's true, what's out there on the internet, what's on TV. We're going to talk about partial knee replacement, computer navigation, and some other things that are out there in joint replacement.
All right, so if anybody's got those creaks and aches in the knees, maybe a little grinding or whatever, if they've got questions, they can come see you.
Yeah, please come out.
All right, good. We'll put all that information on our hotline. If you'd like to find out more, you can contact Southern Joint Replacement Institute. We'll link our website to their website at sjri.com. Also, the doctor's website is jeffhodrickmd.com. We'll give you a link to that as well.